This is the desktop version. And what we do is we can run a workflow. So we point it to a collection of reports, and in here there's mixed reports, there's JPEG, text, etc. And what we can do is pick out of a set of common pipelines. For example, a cancer registry might pick the case finding with coding and T&M. Alternatively, we can build our own knowledge source collection. So I'm going to click noise filter. The oncology source with coding, pharma substances, symptoms and side effects, and document classification, and set it to go. And you can see in the left that it processes the reports very quickly. If I click on any report while it's working, what you see in the far right pane is the actual report text. And in the middle pane are the data elements that were extracted. And this is based on the specific knowledge sources that I had selected. So if I had selected all the knowledge sources, we would have a much bigger data set. But if we take a look, so it classified this as a radiation oncology report. That's pretty straightforward. The anatomical site's breast. It sounds straightforward. Oh, well, you know, we can read that it's a breast report, but it's not always that simple for a machine to do that. So there's a machine learning component that will take a look at this and say, this is a breast report. It'll also show you in the report, highlight what it looked at to make that determination. And talked about cancer reporting. This has been deemed reportable. And we notice that down in the bottom right, there's an explanation. So this explanation is a very specific rule out of this customer's rule set documentation. And it will explain that rule 1B, and this is the reason for it, was the reason why this is a selectable cancer, reportable cancer, and it will also highlight in the report all the things it looked at to make that determination. So one of the added features here is the explanation feature, great for training new registrars and verification. So then we come up to some more complex things. These things with asterisks, they're all inferred. So histology, for example, is something that there's a book, a SEER tumor coding book, is about 2 inches thick, and there's 300 odd rules and different rule sets for each anatomical site. And if we click on that, it will determine that this is M85003 morphology, and the explanation down here, H14, basically says that in the SEER manual, rule H14 for breast was applied, and it showed you why. There's also a confidence interval. Most of the things are highly reliable, and you can be assured that, okay, it's good and we can pass it. We don't need manual review. If the report is a little messed up, or if it's an autopsy report, or if there's a whole bunch of different terms in there, the confidence will show that, and it might flag it for manual review just in case.